Today, I will be going over some things from the last on hantavirus. There were a few incorrect things I mentioned. It is very rare that people can transmit it from one person to another. However, I wanted to give 10 reasons you don't want hantavirus, and I want to give you another 10 ways to avoid hantavirus. This is for educational purposes only. Please use your brain when consuming content on the internet. Here are the reasons you don't want hantavirus. 1. Hantavirus is a serious disease that can cause severe illness and death. 2. People get hantavirus from contact with rodents like rats and mice, especially their urine, droppings, and saliva. 3. The virus can also spread through a rodent bite or scratch, though this is rare. 4. There are two main syndromes caused by hantaviruses, HPS and HFRS. 5. HPS is usually found in the Western Hemisphere, including the US, while HFRS is mostly found in Europe and Asia. 6. The deer mouse is the most common carrier of hantavirus that causes HPS in the US. 7. Symptoms of HPS include fatigue, fever, muscle aches, headaches, dizziness, chills, abdominal problems, coughing, and shortness of breath. 8. HFRS symptoms include intense headaches, back pain, fever/chills, nausea, blurred vision, flushing of the face, inflammation or redness of the eyes, rash, low blood pressure, lack of blood flow, internal bleeding, and acute kidney failure. 9. There is no specific treatment for hantavirus infection. Patients receive supportive care like rest, hydration, and symptom treatment. 10. HPS can be deadly, with a 38% mortality rate among those who develop respiratory symptoms. Now, moving on to 10 ways to avoid hantavirus. 1. Avoid contact with rodent urine, droppings, saliva, and nesting materials. 2. Clean up after mice or rats in your home safely to prevent exposure. 3. Pet rodents are not recommended for families with young children, pregnant women, or people with weakened immune systems. 4. People who handle and clean up after rodents, such as pest exterminators and animal caretakers, should take precautions against hantavirus exposure. 5. Avoid contact with rodent bites or touching contaminated bedding from infected animals. 6. Rodent control is the primary strategy for preventing HPS. Exclude wild rodents from homes near human populations. 7. Safely caring for pet rats can help prevent hemorrhagic fever with renal syndrome, a disease caused by hantavirus infection. 8. Test new rats for hantaviruses before introducing them to a home or breeding facility, especially if they will be living with other rats. 9. Keep wild rats away from pet rats to prevent rodent infestations and potential hantavirus exposure. 10. Wear protective gear when cleaning up after rodents, as different materials are recommended for people with pets versus those dealing with heavy infestations. Now lastly, here is a summary. Hantaviruses are a family of viruses spread by rodents that can cause serious illness or death in people. Most hantaviruses are not transmitted from person to person. Different types of hantaviruses are found in the US, and most can cause hantavirus pulmonary syndrome, a potentially serious disease that damages the lungs. Non-HPS hantavirus infection also occurs, with nonspecific viral symptoms but no cardiopulmonary symptoms. Another serious disease caused by hantaviruses is hemorrhagic fever with renal syndrome, primarily found in Europe and Asia, though sole virus-causing HFRS is worldwide, including the US. The same diagnostic methods are used for both HPS and HFRS. Clinicians should contact state or local health departments if a patient has symptoms compatible with either disease and potential rodent exposure. If you found this content engaging, please give it a like.
This information is for entertainment purposes only. Please consult with a medical professional for real advice. Also, don't forget to subscribe to Kitten Tech, and we love you.